it's so scary that you don't remember any of it.
I know.
You know?
They told my husband to go sit over there.
Yeah, yeah.
And he was like, oh my God, she died.
So when you found out you had twins, you didn't know. Like you didn't go in going, oh, I know I'm having twins or anything.
No,
you went in
not at all.
and like, I think I'm pregnant. And then when did you find out from going in and thinking you're pregnant to like, oh, I have twins?
Yeah. So the first appointment, which was an ultrasound. So I found out I was pregnant 3 weeks, which I was obviously super early. I was very regular. So that Friday I was supposed to get my period.
You were only 3 weeks along when you like
When
got
I found out.
Oh my God. That is super early. That's awesome.
Yes.
That's awesome.
And I think the line was so strong. I mean, I had taken 3 tests, one including that said yes, and then 2 of the lines.
Yeah.
Because my hormones with the twins.
Yeah.
But of course, I didn't look pregnant. I didn't feel pregnant.
Yeah.
We were shocked. We were like, oh my God. And you have your first appointment around 8 weeks. So for 5 weeks, I was like, oh my God, I'm pregnant. Like with one. We didn't even think about the thought of twins. We didn't even joke about it. Like, so that first appointment, I mean, I didn't feel it. I didn't look it. And I honestly, I had this weird feeling of like, okay, I can't look at the screen because what if she doesn't hear a heartbeat?
Oh,
I don't want to think devil's advocate, but I almost didn't want to get too hyped up.
Yeah.
And again, it was just weird because I didn't feel pregnant. I didn't look pregnant. So, and luckily Billy travels a lot for work, my husband. And he actually wasn't going to go to the first appointment. I'm like, oh, it's fine. Yeah. I was more like, you don't need to go. Like, she's just going to like confirm I'm pregnant. Yeah. And thankfully I have another OB friend and she's like, no, he needs to be there. And which I'm like, looking back, I'm like, oh my God, I would have died. I mean, I had to find out I was pregnant by myself because he was on a bachelor party that weekend.
Oh my God.
So I'd already had to find out I was pregnant by myself and then hold it for 2 days. And obviously when he got home, I told him.
Oh, you didn't tell him on the phone or anything? You waited till he got home?
No, because with the time change, he was already drunk at the bars. And he would either have made him drink more and not want to come home. Or I just, and I really wanted to see his reaction in person. So that was hard for me to kind of keep it to myself. It was 2 days though. It wasn't too bad. But then That's
a hard 2 days probably of just like this kind of like,
and then like when he got home, he was so hungover. He wanted to just like eat pizza on the couch. He was like wanting to fall asleep. And I'm like, I came up with this like fun little way of telling him.
I love it.
So fast forward to our first appointment at 8 weeks. So my friend was like, he needs to be there. So and luckily, so we crammed in this small little room. I lay on the table. I'm so early. it's not the ultrasound on my belly. She goes like into my vagina.
The vaginal probe.
Yes. She had made some kind of noise sound where it was like, okay. So when I looked at the screen and she's like, okay. She's like, well, there's one. And Billy and I we were what? And she's like, and there's the other. And I swear to God, I thought she was going to say, and there's the third. Because I'm like, where are we going?
You already kept going once. Yes. Like, when are you going to stop? Yeah.
And I looked at Billy and he just goes, oh, fuck. And I was still like, wait, what? Like, I was still so confused.
It wasn't really resonating at the time.
I could not comprehend what she was saying. And she's like, yeah, you have 2 healthy babies in you. And
Billy, what did you do to me?
Oh my God. I just started laughing. Like all the emotions came. Then I started crying. It was a happy cry. Slash it was like, oh my God, I am going to be so big. Like my belly. Like how is my body going to carry 2 babies?
Yeah. But you did rock star great. Like,
and
insanity.
I am tall. So that helped. Like I never had like acid reflux. I never had like my ribs move. And I was told after that I had a very long cervix. And my OB was like, ooh, you're made for twins. And I'm like, well, I don't know if I would go that far, but that was a good thing.
That was a good thing. That
obviously reduced the risk of preterm labor.
Did you feel like you could tell you were having twins? Like, did you, I don't know, like from your body, were you like, man, if there was one in there, I would definitely not feel the way I feel right now?
It's hard to tell because it was my first pregnancy.
Yeah.
So, and I could go on and on about my pregnancy. I loved being pregnant. So, and I embraced like the tight dresses and the rubbing of my belly. And like, in a way, I was like bigger the better. Like I loved that. So I don't know. I mean, definitely towards the end, I was like, oh my gosh, like there's no way. I mean, I would walk into places at like, even 28, 29, 30 weeks. So I still had, I still went 7 more weeks after that. Yeah. And people were like, do you have to go to the hospital now? And I'm like, I'm having twins. And I'm like, okay.
Okay. Do you find, and I know you said you embraced it. Did you see or feel that people were more I guess, wanting to give you advice or tell you about your body while you were pregnant because you were pregnant? Like, oh, hey, like someone approaching you and just talking to you more and saying stuff?
No, I mean, I never had strangers.
Okay.
But I had friends and family. But a lot of advice that I had, which I would be the number one advice I pass on, is listen to your body.
Yeah.
Listen to your body. And like, you know yourself the best out of any doctor out there and out of any friend, mom. So just listen to your body and your gut feeling and
I tell people that all the time when they're like, is this normal? Like if a patient says to me, is this normal?
Yeah.
I always say, here's what normal physiology is for pregnancy. Here are some concerns it could be. Only you know if what feels different.
Yeah.
No one else can feel that, right? Yeah. So I always tell people too, for trying to advocate, use your words, right, as best you can. Totally. And if I can give you some vocabulary that helps you explain a sensation, you know, because when someone says, I'm having abdominal pain, like when you're pregnant, if you say abdominal pain, okay, can you take one finger and point where it is?
Right.
Or is it everywhere?
Yep.
Does it go somewhere?
Yep.
Is it worse at night?
Yeah.
Is it more when the babies kick?
Yes.
Right? Because it kind of helps. Did you end up having any pain or any kind of, or was it more movements that you could feel or any kind of, it sounds like everything with your pregnancy went like pretty smoothly.
It went pretty smoothly. I remember I was about 26 weeks, 25 weeks, and I had ligament pain.
Yeah.
And it was basically all the pressure and my uterus was stretching. And just all the pressure because I had two babies. So, and everything was growing fast, I remember. And when I say listen to my body, it's more listen to my body. And if anything even slightly is, that's a little weird, ask the question.
Yes.
Ask the question. Like, a lot of my doctors and friends were like, there's no dumb question, especially when you are pregnant with one or two babies.
Yeah.
Just ask it. Better be safe than sorry.
Yeah, for sure. For sure. When you delivered, did you make it to or beyond 37 weeks?
37 weeks in one day.
Yes, you did. Did you go into labor on your own?
No, God, no. The minute I found out I was having twins, I was like, C-section? My doctor was like, yes. I'm like, okay.
There we go.
So I had an amazing pregnancy, but they took baby A out. He was great, wrapped him up, showed me. I was like, okay, he's cute. And then, and my C-section was a scheduled C-section on a Wednesday. I went in to get an NST on Monday at 1 p.m. I'll never forget. Worked from home, went to go to NST, and baby B had kind of stopped practice breathing. And by that time, I mean, I went into that appointment being like, can we just do the C-section today? It's 2 days early. I'm already 37 weeks. Like, we're good. They're like, why don't you just go up to the hospital for further testing? And then I go into the room and they're like, all right, let's have some babies. So it was a little bit of a rush as far as 2 days early, but my husband, this is a crazy story too. He was actually in the middle of resigning.
Oh my gosh.
With his boss. And I called
like in a meeting at the time.
Yeah. And they like, we're still doing the small talk.
Yeah.
And he's like, actually, so we have to postpone this. I actually have to go get my babies. So, so he comes in and he is like anti-blood, he is not medically, like folds up his work clothes and is like, let's do this. Which was good. Like looking back, it was good that he was just thrown into it. Leading up to the entire pregnancy, I'm like, are you going to cut the umbilical cord? He's like, absolutely not. And like he ended up, it was all just like, do this, Billy, do that. So he was just like taking direction.
Yeah. And you can plan as much as you want, but it's the baby show. That's what I always tell people.
Yes,
like
at the end of the day, plan, but
yeah.
You can plan my car seats and diaper bag were in my car, but none of my hospital stay was. So, but it was fine.
Yeah.
My biggest priority was, are my babies safe? Let's keep them safe. So wheel me into the OR. They take baby A out. He's good. Weirdest feeling ever because I don't feel anything down there, but I immediately am like, oh my God, I feel so much lighter. Which that was such a
like
weird,
a pressure, like a weight lifted. Yeah.
And then they got baby B out. I heard him cry and I passed out. And my husband, thought I died.
You legit passed out?
Yeah,
like
I died. I died. I passed out on the OR table.
So so now I'm going into doctor mode really quickly when you say this. So you heard baby B take the scream and you're like, oh good, baby is healthy. And then what's the next thing you remember?
I mean, I don't remember anything.
Nothing.
I do remember Nash, baby B, coming out and hearing him cry. Because it's just like when you're having one or three, you just always want to hear a baby cry. I think that's kind of one thing I've always been kind of told.
Yeah.
I remember waking up so cold. And oh my gosh, after I have these babies, I was a balloon.
Okay, so for someone listening to, tell us where you were swollen, because I know what I'm thinking when you say balloon, but where were you swollen?
I couldn't wear my flip-flops home.
Okay, so your feet for sure.
My legs looked like logs.
Legs. Hands?
My hands.
Yeah.
I felt when I woke up, I was throwing up, which was awful with a C-section. Ugh. I was really, really cold. So in a perfect world, I'd have the C-section. That's like a 10-minute procedure. The babies were out within 2 minutes.
Yeah.
And then someone comes in, stitches me up, and I'm good. You get wheeled into the recovery room, which I'm told you're usually in there for about 20 minutes. In a perfect world, I was in there for an hour and 20 because they were trying to stabilize my blood pressure.
So your blood pressure was too high, not too low. But when you passed out, though, like you don't remember this, but did they tell you? Because usually when people pass out, their blood pressure's low,
or maybe it was low.
Maybe it went low and then I don't know. But
I don't know.
That it's so scary that you don't remember any of it. I know. You know,
they told my husband to go sit over there.
Yeah, yeah,
and he was like, "Oh my God, she died." Yeah, and then they told me I think they said they pumped me full of like 3 bags of fluid.
Yeah,
and I woke up feeling like I had a whole bunch of Botox put into because I was just so swollen,
just taut. Like when you were kind of like with it, right? When you started to really like the anesthesia or whatever, you're waking up, and all this kind of stuff.
Yeah.
How long did that feeling and the swelling last for you?
Well, I'll tell you this. So I had the babies around 5:55 p.m. So let's just say 6 p.m. on a Monday.
Sure.
We left on Friday. So I was in the hospital for 5 days.
Yeah.
And I was great. They actually told me I could have left on Wednesday, but I was like, insurance is covering until Friday. We're staying until Friday. But yes, so the C-section actually wasn't that bad as far as like healing that up. But I remember calling my doctor. I'm like, when is this fluid going away? I look at pictures and I'm like, it was awful.
Wow.
I was a balloon. I looked way worse after pregnancy. And I remember they were like, give it 3 weeks. And I'm telling you, on the 3-week day, and it was very weird. They're like, all of this swelling is fluid that we pumped you full of. And I remember they said I had like protein in my urine, which I think is part of that preeclampsia.
Yeah, for sure.
And they're like, you're either going to sweat it out or pee it out. And I'm like, okay. And then they also were like, drink all the water because you got to start to flush it out. And it was very weird. It would happen to me at night. And not really the sweating. It was the pee. I would wake up. I was so used to at that point for months waking up 5-6 times a night, going to the bathroom.
Yeah.
Going back to, had the babies on a Monday, went home on Friday. All of my levels looked good. Babies were really good. I was still blowing up like a balloon, but they were like, give that time. And then Friday was my first night home and my mom was in town, my mother-in-law. And they woke up the next morning like, how did you sleep, Sierra? And I just like tell it like how it is and how I feel. I was like, my heart, I feel like I'm having a hard time breathing. And I think one of the things they told me was blood clots are a common side effect. So my mom,
fluid on your lungs too.
Yeah. And so my mom, again, I think I get it from her of like, better safe than sorry, just go to the ER.
Yeah.
Just make sure you're checked out. And I was only 5 days post having a C-section with twins. And postpartum preeclampsia. The doctor was awesome. My husband and I were there for, of course, it was ER. So we were there for like 6 hours that Saturday. But they ended up running a whole CT scan on my abdomen.
And your chest and heart, kind of like your like chest area.
All of that. And they ruled out a lot of things. They said, I'm good. But they ended up putting me on blood pressure medicine. My blood pressure was still a little high, I think. And so I took that for 5 or 7 more days and then we checked it and then it was good.
So once you diuresed or peed off all that extra fluid, which we call third spacing, would you say that after you peed off all the stuff that is that when the blood pressures finally got better-ish?
No, because I was still a balloon like literally up until 3 weeks.
Yeah.
And they had checked my blood pressure. I think I went in that following week and it was better.
Okay, good. So they're not identical.
No.
Could you tell them apart right at birth? Were you like, oh, they look so different
Not
to you?
Not like so different, but that was like the one mystery surprise that no one could tell. Although we had really good images from the ultrasound where we knew that they had different noses, different facial structures throughout the ultrasound. So we were like, okay, these, and they obviously are fraternal, but there are fraternal twins out there. I always think of Mary Kay and Ashley Olsen. They look identical, but they're fraternal.
I didn't know that.
Yes.
They look so identical.
So when we found out we were fraternal, the doctor automatically was like, don't worry, they're not going to look alike. And I'm like, wait. You don't know that. Like the Olsen twins.
Oh my gosh.
But
I like to circle back to impact all the time on like, how can we help people have how can we have a positive impact on others and then they kind of pay it forward?
I always try to look at the positive. Yeah. And that, I don't know, I feel like there is such a powerful connection of how my energy is to the babies.
Yeah.
I mean, I want to say that I had an awesome pregnancy and I love being pregnant. And then I ended up having like really easy, good babies.
Yeah.
And I actually did have a lot of people afterwards and they're like, yep, of course you have good babies because you had a really good pregnancy. That was my take on it.
Yeah. Thank you for coming today and sharing your story with us and having all the listeners kind of hear your story and learn more along the way.
Absolutely. It's a pleasure.
Thank you.